Okay, so the most frequent questions my patient ask me about snoring usually is not they themselves coming forward complaining they have snoring. It's usually their partners or their family members, those who sleep with them. They complain some of their partners have loud snoring and it's affecting the other partners, and then that's why they came to our clinic to get help. So snoring is actually a problem that has been bothering a lot of us, especially during this millennia. So as I mentioned just now, there are a lot of causes that can lead to snoring. The number one is mouth anatomy. Whenever you have large tonsil or narrow airway, that can cause snoring as well. Number two is if you are a frequent alcohol drinker, alcohol consumption will relax the muscle around your throat and then cause the airway to get narrower, and then it can cause snoring as well. So number three, you have family genetic issue. You're prone to have narrow airway, then you get snoring as well. So these are the few things that can cause snoring. So you really have to sit down with your doctors and then consult with them and then see which one is the cause that leads to your snoring, and then they can treat the root cause of the problem. Snoring is actually quite common in our group of people, especially nowadays. So the risk of snoring is actually whenever, if you let it escalate, it can lead it to obstructive sleep apnea, which is a serious condition that basically is just your airway being blocked when you are asleep by the soft tissue around your neck. It will cause you to lose concentration in the beginning, and then you fatigue all the time, and then you lose your good rest sleep, and then you feel very grumpy in the morning, and then you feel tired all the time, you're sleepy, and then at the end you start to develop high blood pressure, you start to develop headaches, and then it can lead to heart attack and stroke. So this thing is actually quite serious, and it's actually reversible if you find it detected early. So what we can do for snoring is we have a machine called Photona Night Glaze. It's actually what we use a laser energy trying to tighten and lift up the soft tissue around your neck. We open up your airway, allowing more air to go in every time you breathe whenever you are asleep, and then this will reduce the snoring, and then also your partner will appreciate, especially when they are asleep beside you. Yeah. So what the entire process usually it takes me about 15 to 20 minutes to complete it. However, you must complete a certain number of sessions, usually between 6 to 8 sessions, depends on your severity. The more severe it is, then you have to go through more sessions in order to see more results. So it's a treatment that you have to maintain it in order to get rid of all of the snoring itself. So usually I recommend the patient to download an app in their phone to monitor the voice or the sound, the noise whenever they are asleep, to see whether there are any improvement or not. Usually my patient will see drastic improvement during the first and second session. So the side effects from the treatments is usually a little bit of throat dryness of the laser, and then sometimes some of my patients they develop a small ulcers, but usually it will heal itself between 1 to 2 days, but that's about it. There's no pain, there's no swelling at all, and then the procedure is actually quite tolerable without any sort of anesthetics, numbing or anything like that. So as a conclusion, snoring is actually quite curable if you detect it quite early. And if, let's say, it's quite serious, sometimes we can combine with other things such as lose weight, or sometimes we can combine with surgical intervention if for those serious cases. But usually, majority of the patients, they are like in the mild to moderate level. So if you can detect it early, actually you can treat it completely.